And joining us now, someone who knows a thing or two about preparing for pandemics, President Obama's Ebola czar and current Joe Biden advisor, Ronald Klain. Thanks so much for taking the time to talk with us tonight.
Thanks for having me, Lindsay.
So when we last talked more than 2 months ago, you told us that the virus has the power to decide what's open and what's closed. Today, as we speak, are you concerned about the direction the country is headed? And how could this surge have been prevented?
Well, of course, I think we should all be concerned. We saw a record number of cases in America today and the potential for this to even get worse. And look, how could it have been prevented? It could have been prevented if President Trump had done the right things from the start, which was to expand testing, not criticize testing or try to reduce it, to match the testing with contact tracing to isolate chains of transmission, to promote mask wearing and other practices to keep us all safe. This isn't hypothetical, Lindsay. You know, in Europe, they had the same peak number of cases that we had. They're now down to 4,000 cases a day. We're at 40,000 cases a day. They did the right things. We did the wrong things.
What's your number one piece of advice for governors in states where they're seeing a surge in cases right now?
Well, I think the number one piece of advice is they need to make sure their healthcare system is ready to deal with it. Again, President Trump's sent little or no help to places like Texas, to places like Florida, places that are seeing a real strain on their capacity. That's the real danger here. It's not just deaths due to COVID. It's that hospitals get overwhelmed, people don't get treatment for other ailments as well. We're seeing emergency rooms, ICUs, at the breaking point in some of these states. The federal government should be constructing emergency hospitals, emergency capacity in these states quickly so we make sure they don't get past the breaking point. Then they have to make sure they're ramping up testing. President Trump announced we're going to stop federal support for testing in states like Texas just when we need to increase the amount of testing and then trace the people who have the virus.
Now, over a period of about 30 minutes Wednesday afternoon, our affiliate in Myrtle Beach counted 208 people walking by their camera on the boardwalk. Only 4 of them were wearing masks. Now, you can tell people to wear masks, but when it comes down to it, if they don't listen, what can be done to enforce it?
Well, I think enforcing it's very hard. I mean, in an earlier segment, you talked about fines and penalties, but we need to persuade people to wear masks. It's like drunk driving. I hear people say, it's my body, it's my choice. Well, it's not your body, your choice to get loaded up on liquor and get in a car and put other people at risk. A failure to wear masks not only puts you at risk, more importantly, it puts other people at risk. We understand there's a rule against drunk driving. We understand there's a rule against walking into a restaurant with no shoes on and getting other people contaminated and sick. Wearing a mask is the same way. I'll tell you how we could start. The President of the United States could set an example, put a mask on, and encourage other people to do that.
New York City, of course, the first epicenter of this pandemic in the U.S., is now headed toward phase 3 in early July. And certainly we cannot forget that this came with an immense cost in terms of human lives. Does the surge elsewhere now threaten the progress that places like New York and New Jersey have made?
Of course it does. I mean, we saw the amazing announcement yesterday, Lindsay, that New York, New Jersey, and Connecticut are requiring people from a list of states, including Florida and Texas, to quarantine before they come. We have quarantines inside the United States now because we've allowed each state to pursue its own path. Some states have done better. Other states have done worse. We're kind of dividing up as a country, and that's really the wrong way to go. We needed a national strategy, national leadership. If the disease rages out of control in places like Florida, Texas, other states in the South and the West, eventually it will climb back up in the states that have done the right things to try to bring under control. We're a unified country. That's what's going to happen if we don't have national leadership and national action on this.
And you talk about national leadership, national action. So is the bottom line here, in your opinion, that a more nationalized strategy is necessary? And what should the federal government be mandating? Testing for everyone?
They should certainly ramp up testing. The goal would be to have every American have testing as often as they need it, and certainly regular testing for people. It's funny, they test everyone every day at the White House. They have federal testing at the White House. Well, if you go to your job, you don't get the same thing. If it's good enough for the people who work at the White House, it should be good enough for people in every workplace in America.
Ron Klain, thank you so much for your time. We appreciate it.
Thanks, Lindsay.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.